In today's Health Watch, there's new hope for people living with Alzheimer's, a disease that affects almost 7 million Americans. The FDA approved a new treatment just yesterday designed to slow the progression of early symptomatic Alzheimer's disease. CBS News chief medical correspondent Dr. Jon LaPook is here at the table to discuss. Morning, good to see you. This sounds important and very exciting, is it?
Yeah, I mean, it is to me. It's an incremental advance. The medication is called donanemab. The brand name is Kisunla. And what it did is, in a big trial, it slowed the decline of cognitive function overall by about 22% over 18 months. And even more if you started off with less severe disease. That may sound like, oh, what's the big deal? Well, that's a big deal if you have a wedding, something in your life, if you want to do something. So that's an incremental advance. We're not reversing it. It's not a cure.
You're slowing it down.
Slow the decline. I think that's important. It works by binding amyloid, which we've heard about for years, this gooey substance that covers the nerves, and it stops the nerve cells from talking with each other. And the idea was to try to get that out. They do it with monthly infusions.
Who should be taking it?
Well, it's people now. It's only
who should
people,
not be taking it?
Well, a lot bigger question. It's people. It's only been shown to work for people with early onset cognitive.
How early are we talking?
There are different ways of measuring it, and you do tests. And in the early part of dementia, it has to be Alzheimer's. You have to have that amyloid stuff, right? Okay. And if you remember, about a year ago, we were sitting around here the same thing with a different drug called lecanemab, or the brand name is Leqembi, and it had a kind of a similar finding. And why is that important? Same kind of approach. For years, why was it that all of those trials, remember how many of them, I remember doing it 20 years ago, we're going to give amyloid, we're going to sop up, we're going to give drugs to sop up the amyloid, and the people are going to do better. They didn't do better. And the answer is we were probably giving it too late. Now what's happened is there are more advanced imaging techniques like PET amyloid, PET scans that can look at amyloid in somebody's brain and make that diagnosis while they're still alive and say, oh, they may have minimal symptoms, but you know what? They're on their way. They have early Alzheimer's, and let's try to treat them earlier rather than later.
So how quickly could patients potentially take this medicine, and what's the cost?
Well, Lilly says it'll be available in weeks. It was just approved.
Wow.
The cost is list price about $32,000 a year. It's covered by Medicare Part B. People who have their private insurance will have to see what happens with that. But for me, it's exciting. I'm cautiously optimistic, and I think in the future we're going to see a bunch of different approaches, including a cocktail of different medications.
Dr. Jon LaPook, thank you so much.
Thank you very much.
We'll be right back.